going to start our exclusive webinar with Professor Dr. A.B.M Abdullah, who is the medicine specialist, senior physician, personal physician of the Honorable Prime Minister Sheikh Hasina. He is now working with the University Grant Commission. Sir, welcome with us for participating today's webinar, sir.
Thank you very much. Thank you also, others, everybody, for this nice session also.
So we'd like to discuss about the situation in Bangladesh regarding the COVID-19, as well as we are thinking that this COVID may stay long time in our country as well as globally. There is a new concept that new normal life we need to adapt within our lifestyle. So in that perspective, we'll discuss today. So first, we want to hear about what is the present situation of COVID-19 in Bangladesh. How do you see the present situation?
Thank you very much. Also, I welcome everybody, the audience, those who are looking this beautiful session. Actually, if you look for the last few days or even weeks, what we are observing day by day, number of COVID, number of COVID affected people are day by day actually increasing. Not very high, but it is not coming down also. More or less at present, every day we count the number, almost 2,000, 3,000 or slightly more and less within this limit. So it is not actually not much increasing, but it's not decreasing also. So in our term, what we call static or plateau actually. And at the same time, number of affected person also increasing and at the same time also number of death, more or less, is quite high day by day, almost same 3 to 40, 30, 40, 42, 45, 46, which is increasing actually. So what we are feeling, actually, COVID, we don't know where it will go from not only from Bangladesh, while it will go away from whole, but actually we do not know. Probably what we are looking, people are also reluctant. They do not care about the COVID. They are not afraid of COVID at all. If you look at the lifestyle even in Dhaka city, all throughout the country, it is more or less as before. Traffic jam, footpath, shop, office, restaurant, park, bus, train, launch, wherever you will see people, they are working, they are doing their work as it was before. And every day, even in the hospital, I've seen few days in the outdoor, lot of person. They are working or they are sitting neck to neck almost. So as a result, number of affected person, this COVID, what we are looking is quite increasing number. There is actually when it will go away or whether at all it will decrease or not. So it is difficult to say because most of the people, they are not aware of about the COVID. They are not taking what we tell about the healthcare. At least we are telling to the people must wear the mask and also maintain the physical distance, wash the hands. Many, they are not obeying this thing, especially the mask. We are repeatedly telling to the people must use mask because it will actually prevent 60 to 80% from COVID. But people, they are not aware. Even in Dhaka, probably 30 or 40% people are using the mask. Many are not using. Even in Dhaka, this is the situation. Outside Dhaka, even in the village, most people are reluctant. They are not using masks almost at all. They are not aware about the corona at all. What is the reality of this country? And probably not only in this country, throughout the world actually. Few days, or weeks, I have seen in the media that in Germany, Berlin, there is a big procession against lockdown, against using masks. The people are not only in Germany. I've seen in Chile, Argentina, Spain, and some other independent countries also. They are not obeying this thing. Actually. So this is the reason. Almost in every country, number of affected persons are increasing. Even today, if you just look carefully, the neighboring country like India, today probably it has cost 70,000 in one day, 71,000 or like this, affected person. So everywhere number of COVID-19 person are day by day increasing actually. This is the present situation at present in our country also.
So, if I just share with you, if you look at that, nowadays the death rate is increasing, but in our country, the infectious people rate is almost same we found for the last few months. Like 20% people are affected. Among those are, given their sample for testing. What do you think? Like, people did not follow the, social distinction and other, rules and regulation government given. But data shows that it is a normal, 20% always. So what is your impression about this 20%, infection rate?
What I should say, but 20%, 20, around 20, 20, 22, even it is less nowadays, 1980, even if yesterday it was 17. Thing is, what I feel, this is not the real picture of the whole country. The number of tests is actually less. Even it was 20,000, 18,000, 15,000 like that. But now it is around 10,000, 10,000, 12,000. With this count, with this testing number, you cannot tell the real picture of the whole country. Because you're testing 10 or 12,000, you're telling how much affected, just you're telling. But in reality, my feeling is probably the COVID-19 affected person, even 3 or 4 times than the real one. If we were telling 20, but there is not the real picture actually. If we could do the more and more tests, really we could get the real picture. But people are reluctant also. They don't like to perform the test also. If we ask to the people, even they have symptoms, fever, cough, pain, sore throat, or loss of taste sensation, anosmia like that. If you tell the people are reluctant, they don't like to test also. Because there are many reasons also behind this. So actually, even the affected person, they used to, because they know the treatment thing also, the media, Facebook, television, newspaper, people have some idea, nothing to be done. Even it is positive or negative, treatment are said. So even the affected person, they have the symptom, they are reluctant to perform the test. There is one thing also, just a few weeks before, it is really what we, some of us, not some of us, some people, that is really a dangerous thing. They have given the report without testing. Without testing, they have given the report positive or negative. So the people have some loss of confidence also. That is also a reason people are away or they are reluctant to perform the test. There is another thing that, the main test what we are doing is RT-PCR. It's quite expensive also, one thing. Second also, there is a big queue. Initially, only one center they used to perform the IDCR. Or even now, we are more than 80 centers. So there was initially very, very big rush. Big queue, old, elderly, female, children. Sometimes they were fed up with that test. And that is another reason. Now, many centers, 80 centers or more, technicians they're sitting idle and almost few or nobody, they're going to perform the test. So that is a problem really. We cannot perform the number or increase the number of tests. So we are, until and unless we increase the number of tests, will not be able to the real affected person.
Hello. Hello. স্যার আপনি একটু আনমিউট করে নিতে হবে স্যার, আপনার এটা স্যার মিউট হয়ে গেছে স্যার। জি স্যার।
এখন ঠিক আছে?
হ্যাঁ।
শোনা যায়?
জি স্যার।
Okay. Actually, previously also in many media and repeatedly I also requested to perform the rapid test, which can be done. It is antibody based, antibody or antigen based. So antibody based is not much helpful. It's helpful for the surveillance, not for diagnosis. That's true. And it takes time also. It is positive usually after 14 days. And there is another test, antigen based, which can be done within few days, and diagnosis can be easier. I repeatedly asked, probably government has given permission about the antigen test, not the antibody. And that is more easier. Which one? I think best will be antigen based, also antibody that is required. It will take only 15 minutes. That is, and cost also is quite less. So if you could start these tests, antigen based or antibody tests or both, probably it will be much helpful. We can do even hundreds and thousands, even 1 lakh like that, 100,000 we can perform this in one day. So I think that stage should be started as early as possible. Otherwise, daily we will not be able to know the real picture of this country. That is a fact, actually.
So I think that for a country like Bangladesh, it is important to have a appropriate information, appropriate data, because on the base of the proper data, government can take or make the proper planning. As we know that you are involved in the high-level, decision-making process, like we saw in different media that when Prime Minister did different meeting, you were present there, and it is a very high-level, policy-level meeting. But this is my curiosity. When you don't have any proper, data, proper information, how Prime Minister and your team took the decision, appropriate decision? Did you feel any complexity in that perspective?
No. One thing, actually, I am really just working as a physician, mainly Prime Minister's physician. Actually, I'm not in an executive post. Actually, I'm not in even any advisory committee like that. There are meetings, that is true. I used to present, that is also true. But it does not mean I have got the capacity or executive power. That is not true. What I give suggestion, it is out on my own because of relation with PM. That is the reality. Really, there are health ministry, the director general of health, and there are many other persons attached to this. And also there is an advisory committee, including 17 members. They used to take the decision mostly. Sometimes I used to present, sometimes they call me if they feel, sometimes they do not call. What suggestion I have given, that is purely because of personal relation. Is not my executive power or like that. But that is true. Sometimes, if whatever I feel, any crisis moment from the beginning of the corona, it is about in about 5 months back, in March 8th, the first 3 cases were we could detect 3 cases. I was involved from that time. That is true. But the thing is, many decisions is the administrative decision or ministerial decision. They used to take the decision. Many things. What should be done about the hospital, management, PPE, and also there are many hospitals that called COVID hospital. That is they used to take the decision. Even just yesterday there is one decision about the trial of Chinese vaccine also. That is also at the level of ministry and with also Prime Minister. There is no doubt. I was not really directly involved in this sort of really administrative or decision-making policy. I'm not really I'm not involved in that matter.
So what do you think that, as we are feeling that we have to live with COVID-19, do you believe that we have to live with COVID-19?
Actually, what I believe or everyone believe doesn't matter. Even WHO, they were telling probably it will not go away from not only this case throughout the world. No, but it will not go away. We do not know when it will go actually. And another thing also, even WHO, they were telling one, I also used to tell, there are many other viruses in the environment throughout the country, hepatitis B, C, then HIV, influenza, flu, other like that. There are many others. There are also vaccines against some. And we are living with that type of virus. Probably we'll have to live in future with COVID-19 also. Until and unless we'll get an effective vaccine, it will not go or will not get rid of from the effect of this COVID actually 19. Because until and unless we get a vaccine, just prevention is better than cure. We must tell the preventive measure. That is the main thing. Because if virus, this is not a living organism. It is just a particular, not living organism. So whatever measurement or preventive measure we are taking, it is just a protection. Person, family, surroundings, countries, people of whole country like that. But really, because it is it is highly contagious also. So that is another problem. We are just fighting against an invisible enemy. So we are not going, we do not know even the biggest country throughout the world, those who have money, technology, scientists, so many things, still they are fed up. They could not actually control, or they are unable to control also this COVID virus. So really it is, I don't know, or we do not know, nobody knows when we will be able to get free totally from this COVID-19 virus, and probably for our life and also to save our life, to save our family, to save our people, probably we'll have to live or we'll have to adjust our life with coronavirus in our future life also.
So in that perspective, if we need to live with this COVID-19 virus, and as you said that we may need to wait until effective vaccine come up, as you know, recently, as you mentioned about China has started their third phase virus vaccination research. So it will take time to complete that third phase too. So in that perspective, what type of change we need to adopt in our lifestyle, as well as that government different management system to live with COVID-19? So the 2 points. One is individual people, what they need to change in their lifestyle. Second is how government management will adapt this COVID-19 within their management system.
Now, one thing is vaccine. Already government has given permission to the China. There is one, biotech, Sinovac, They are going to start a vaccine trial. Then there is the final phase in this country. Ultimately, we do not know how much it will be affected. Probably within 2 or 3 months, we'll be able to know how much. Not only this vaccine, there are many other organizations or many countries like, even neighboring country, India, when the Oxford, Moderna, even Russia also, they have started one vaccine. Anyway, the thing is, until and unless we get a vaccine, always for our people, what we need, preventive measure is more. Only 2, 3 things. One thing, whenever you go outside our house or home, must use mask. So that may give protection in 60 to 80%. That is must. Compulsory, but unfortunately many they are not using. That is also. And second point is washing of the hands. People knows this with just simple soap, 20 seconds, this. And also must maintain the physical distance. Or somebody tells social distance, that is not true. Actually, the physical distance, at least 3 feet apart. Even in USA, they used to tell 6 feet. That's 3 things, simple things. If we just adapt or maintain this simple thing, and if we maintain this thing, then it will be easier for everyone to protect or prevent from this COVID-19 attack. But one thing, for people, what I used to suggest many times, but in my life, my policies depends totally on me, my security, my safety. If I do not follow for myself, nobody can protect. I must also realize my safety is not only for myself. I must be free from effect of COVID-19. My family, brother, sister, father, mother, everybody, even the surroundings, we also, everybody, we must be free from this COVID attack. It is not only me, everybody, whole countrymen. So preventive measure is very, very important. It depends on totally me also. What you told, Ministry of Health or government, whatever, they have also much more responsibility, no doubt. But thing is, there must be a coordination or coordination or correlation, whatever you tell, by the government or administrator or Ministry of Health or DGL, whatever it is, administration and us people. So we need a coordination between these two. So if you just continue or follow or maintain the coordination between these two parts, it will be easier for us, for everybody, to get free, or at least we can protect ourselves from the attack of COVID-19. But again, one thing, my protection depends entirely on me. If I not obey what I used to tell, we must be careful, we must obey the health rule, everything. Wearing masks, washing hands, physical, everything. These things will help us to prevent or protect from COVID-19 attack. Otherwise, it will be difficult. Number of COVID patients is increasing day by day. Death rate also is. Nobody knows when will be affected, who will be affected. So everybody is vulnerable. Though we used to tell above 60, those who have comorbidity, especially diabetes, those who are suffering from diabetes, high blood pressure, cancer, liver disease, kidney disease, stroke, like that, anyone can be affected anytime. And corona will not see also who is the prime minister, who is the MP or businessman, poor, rich, servant, or and it like this. It will affect any person. This is the character of corona. So nobody is safe from corona. And also one thing, some people of wrong conception, especially the poor people, they think, the lower income group, they think it is the disease of the rich man. Enlightened people, high society people, they are the lower income group, poor people, day labor, like that. They are thinking, even those who are in the Islam area, they are thinking also. But that is not true. Corona can affect any person. It will not see whoever, who is he, that is not the concern with the corona. So we must be careful, everybody. Whatever, I am a street beggar or footpath worker or rickshawala or transport, working in transport or office, rich, poor, that does not matter. Everyone we must take our protection for ourselves to save me, my family, my neighbors, also the whole countrymen. So that is our responsibility also.
Sir, in that perspective, recently we saw that different developed countries, they opened their school and education institution, and lots of children, school children, were affected. And our honorable education minister, she said that she's not going to open education institution for the children because she thinks that it's important to save the children's life. What do you think?
Just repeat the question. I could not actually follow. Just repeat the question.
Sir, recently, we saw that lots of internationally different countries, schools were open and school children were infected. Our honorable education minister, she mentioned that she wants to save the children's life, not by opening the school. So she declared that she's not going to open the school. So what is your understanding about her decision?
Yes.
And one important point, what do you think about education in institution, like medical college?
No, that is important. Actually, what I told repeatedly also, it is very difficult to start actually to open the school. School means, primary school, high school, college, university, medical college, many institutions, engineering, agriculture, like that. Especially what I told, actually, because we are just still not free from any infection, and day by day number is increasing. So I think we'll have to wait, or just another few weeks or months, just to see what is the rate of infection. Ideally, when the infection infection rate will come down less than 5, then actually we can tell probably number of infection is increasing, then everything will be normal, that we can tell. But though everything is normal nowadays, office, transport, bus, train, lawns, market, footpath, everything looks normal. But school, especially the primary school, small baby, they'll go to the school, small classroom, 100 students. It's very difficult to maintain the physical distance. Probably they'll not use mask. They'll go to the field and they'll play. So they'll have a contact with each other. We do not know who is carrying the virus. One thing. So there is every child, and there are many other staff also in the school, teacher, other staff. So there is another thing. So the physical distance will be difficult. Nobody will maintain the physical distance. One. Second, especially the primary school, even the high school, usually mother or any guardian, they used to take the baby in the school. So they will send the baby to the school, and they will, in hundreds of mothers, they will wait outside the gate or boundary of the school. So there is every chance of transmission also among them. And another thing, the baby, this young chap or the primary school or high school student, they may be infected and they'll go to the house, they'll infect their mother, father, grandfather, grandmother, everybody. There is every chance of spreading the infection. So my suggestion, not to open the school at present. Just we see after a few days, we'll observe. If the situation is increasing, we see, or number of affected person is less, even I should say it should be less than 5%, then probably we'll think school should be open. Even the examination government already they have taken the decision. JSC, JDC, HSC like that. For the time being, all the examinations are postponed at present. Government will take decision in what way they can take them with the examination, in what way they'll probably expert will give their suggestion about the examination, but it is postponed nowadays. So what I should say again, just we should wait some weeks or even 1 month just to see the situation, and then we will take the decision slowly. And also, if the government feels or ministry feels, they can take the opinion of some expert in this subject, public health worker, physician, and many social workers. They can discuss with them, because we cannot put our baby, everybody's baby, in a dangerous situation like this. If one of the kid is affected, so not only he is a sufferer, father, mother, everybody, there's been tension also. There is a dangerous for the whole country. Even you are telling, in many countries in the Western world, open the school, have seen there are a lot of spread among the students. So they have again closed the school. So we must think again before opening the school. We must think repeatedly, because it may be a dangerous or catastrophe, whatever you tell. But we will not compare, because many other people, they are in the office, they are going outside, traffic jam like that. We should not think in that way. For the student, we must think in a different way. So that is the important thing, and that is my suggestion also. We must observe some few days, then we'll think whether it should be over or can be opened or not.
So, you know that in Bangladesh we lost highest number of doctors, physicians, as well as number of infected health workers is highest among other neighbor countries compared to also from the developed countries. What is your impression about this highest infection and death rate of healthcare workers?
Now, it is a fact actually. We lost many doctors, my colleagues, my senior, my juniors. That is true. And many are my students also. And health workers also, many nurse, other health workers. That is true. With other eminent persons also in the country. There was one complaint in the beginning, because doctors are the frontline fighters. Not only doctors, health workers also. So any doctors, anyone, they used to come with the direct contact with the patient. So any doctor, he used to talk with the patient. I'm telling the COVID actually. Talk with the patient, put their hands, see the pulse, blood pressure, put the stethoscope. So there is every chance of contamination also. Even in ICU, many patients, sometimes they need ICU support or ventilatory support. So in ICU, there is transmission rather more than the outside the ICU, because doctor directly come in contact, like a CB line, IV line, rice tube, oxygen, so everything. So there is every chance of contamination. That is the reason doctors are infected more, death rate is quite high because of many reasons. One thing, in the beginning, there is a complaint because doctors are not getting their protective equipment properly. PPE, what you should tell, even mask, cap, you call the gown, that was not proper and quality was not really good. That was the main complaint. So with this poor quality PPE, they have to see the patient, they have examined the patient. So there is chance of infection is more among the doctors, and also some senior doctors, some died senior doctors. They were suffering from other disease also, diabetes, high blood pressure, heart disease like that. So that is the reason death rate among the doctors are quite high. One, frontline fighters, that is true. There is infective chance is very, very more because they are contact with the patient. And third is their personal protective equipment was not sufficient and the quality was poor from the beginning. Though situation is improved now, still some doctors still now are dying also. We are almost in every day we are facing this problem. But still, we are not afraid. Doctors are efficient nowadays. They are fighting as a frontline fighter, and they are managing the COVID-affected patients quite properly, which they are fighting to. Not only doctors, other health workers also.
So, in that perspective, if we consider that we have to live with this COVID-19. There is a risk of infection for the doctors. What is your understanding that regarding this health system? If I ask you that any restructure we need for the health system, what type of restructure you will propose?
I think there are a lot of complaints against the Ministry of Health, Health Directorate, and also from the root level. I mean, this is not only new. It was before for long and long years or long time. Many people they have the complaint against the ministry or health system. Many things, especially the corruption, lack of coordination, and especially the everywhere. It is not probably what I think, not in it's almost every ministry. But the thing is, this corona, after the corona effect, it is opened actually. You can see our weak point, our health system, our planning, our corruption, all has opened. So we must need a beautiful structure. We must reform the health system totally. Otherwise, sometimes the sending one person or transferring one person from one place to another, and that will not solve the problem actually. So we must reform our health system from top to bottom, up to the village level or upajala, what to tell, over the district, capital, big city, whatever it is. So if we do not reform, or if we do not change the system of the present system of the health, it is very difficult to improve and will not be able to fight. It is not only for the COVID. There are many other things. There are a lot of complaints against the health system, against the doctors, health workers, those who are in the administrative line in the health system. So there are a lot of people by the general people again. People have loss of confidence, totally almost, confidence about the health system. So from now we must start to reform or reconstruct our health system. Otherwise, it will be difficult to improve the health system of the whole country. We cannot improve the health of the people. It is not only from corona, from other diseases also. So it is a very important or very essential part of nowadays. And we'll have to, in future, we must, whatever we do, we must keep in mind the change of system. Without changing the system, we cannot improve the whole system of this country.
Sir, as you said that there is a difficult, and also you mentioned that we have to wait for the vaccination, which can really important for having the cope up this COVID in our lifestyle. What is your understanding? How long time it will take to have the vaccine in Bangladesh?
Now, actually, it is difficult to say, but I think many countries, even 126 organizations, they are trying to find out a new one or effective vaccine. At present, I told already that China, neighboring country India, Oxford, Moderna, Russia, almost nearly there is the final stage. They are giving trial. China, suppose the third stage, even in Oxford in third stage, Moderna, they are telling the third one is the final stage. So after there, we can tell, even the Oxford or Moderna, they are telling probably they'll be able to prepare a vaccine by October. So what I feel, even in not in October, probably at the end of this year, even in December, probably we'll get a vaccine. And not only our country, throughout the world, people are waiting for the vaccine actually. But what I feel, our administration or ministry or government must try or must prepare the infrastructure or must try to get the vaccine. So we must try for whatever we call that we call lobbying, dashing, pushing, whatever you tell, even in government to government level, then they can start talking, prepare infrastructure we can make. Another thing also, whenever we get vaccine, you must be careful about the preservation of vaccine, syringe, step, and then also manpower. In other words, I'm telling the framework or planning or infrastructure, we must start to make it now at present, from the present situation. In future, whenever you will get the vaccine, what I told, maybe in December, yes, no problem. 2 months, 3 months, probably we'll get a vaccine. Once it will come, people will get the vaccine. In the world, there'll be a vaccine. A big country, rich country, there will be a competition against. Probably there will be business also, and there will be politics also. They will try to get the vaccine earlier as early as possible. So we must start our effort from the beginning, from now, so that once the vaccine will be available in the world, we can get it as early as possible in the earliest possible time. Otherwise, probably it will be delayed, it takes months or years. If we do not start the basics working now. So that is the main thing I should say. Another thing, we should make another planning to whom will give the vaccine. That means priority. I told repeatedly, priority means those who need, because 17 crore people in this country, you cannot give the vaccine at a time in all the people. It is not possible. So those who need first or priority basis, suppose the elderly above 60, those who have comorbidity like diabetes, high blood pressure, stroke, cancer, liver, like that. Number one group, second group, then frontline fighters, means doctor, nurses, and other health workers, and also other frontline fighters, the security, those related to police, army, BJP, like that, or answer, like that, and also media worker, I should say also, they are the frontline fighters also. Any journalist, TV, Facebook, television, whatever it is, they are also fighters. So they should get first according to the priority. First, we should give vaccine to them, and then step by step, other people will have to give the vaccine. So that is also it needs a good planning from now also. Whenever the vaccine will come or it will be available, so you start vaccine in that way, step by step. And that will be probably more practical and effective also.
So in that perspective, I have one observation. Like if you look at that, the last 12 years, our government did a very excellent job in terms of socio-economic perspective. Our development is really, positive in different sectors. But when you look at that, health sector related research, like clinical research, vaccine research, we found that we are still far more behind from the different countries. Even if you compare with the India, then we are far more behind than the India in terms of, clinical research and bioequivalent related research and biotechnological related research. What do you think that, I think that in scientific area, as a health is an important issue, so you also need to build the capacity and invest more in that perspective. Because there is like 160 million people or 180 million people we have an inner consumer for drugs and other perspective. So as a public health specialist, I feel that we need to invest more in clinical research perspective. What is your understanding, sir?
No, understanding when there is the weak point of our health system also. We must do the research, we continue the research, because unless we make a research or we do the research, will not be able to know the health perspective of our country people. Just what in other countries they are doing the research. Why we should not continue? It must be because so many people. You told 170, 180 million people, and our health system may not be in other countries' health system also. Our health pattern, health style, our social condition. With that perspective, I think research is a must. We must continue it. It is not only related to COVID, many other diseases also. You're telling many other diseases, mean infectious disease, non-communicable disease, and also you told about the drugs. It is also important that many drugs we can continue the research, especially also the vaccine probably will come. Not only corona, there are other vaccines also. In every step, we must continue this thing. Otherwise, I cannot improve the health system because there is a competition of the world, throughout the world. So with the competition, if we do not do, so what we will, other countries will go far and far. They will proceed and will go back behind. So it cannot be. So if that is true, I agree with you. Research, there is no alternative. We must continue in not only here, in every step. Because COVID has come, we'll work research on only COVID, no. Every step of health system, it must be. Otherwise, because many of our doctors, many of our health workers, they are also efficient. Just if we start our research working, and if we give chance to these brilliant people, probably research will go further also in future. It will be effective. It's not only for myself, it's for the whole mankind, not only for the country, not only for the country's people. Really an effective research will be held throughout the mankind, throughout the world. It's quite important. I think it should be content, must be done. Must not be reluctant also in this field of health or subject or medicine, however you tell, or public health, everywhere must do the research.
So what is your understanding this time during COVID period? How did you find that UN organizations like WHO, UNICEF, UNFPA, then donor agencies like USAID, DFID, Canadian CIDA, Swedish CIDA, how they stand beside our government or beside our people? What is your understanding about their activities?
No, actually, these are international organizations. They are doing their work. That is true. I told in the beginning, there may be politics, business, many things, but what I feel, whatever work they are doing, let them do their work. But what we need then as a general people, we want what is good for us. That is true. And this sort of organization, they are dealing with the government directly. So our government also take initiative. Should invite them. We must take the good side. They have also very good thing also. They are doing also research. They want to help us also. We must take this also. Suppose the China has this vaccine, because they are going to start very soon. It's a good thing for us. And we'll have to pay for that. They are paying. Once in effectiveness, maybe we'll get first on the best of priority. And maybe we get free of cost also. So the way, same way WHO or what other organizations told, because they want to help the people also. They are wishing or they are used to help our people or people of this country. So we must cooperate with them also, because they need our cooperation. Without our cooperation, they cannot work by their own also. That is also important. So it's a mutual thing. They will help us. We will also cooperate them together. If we proceed together, that will be, I think, good thing for us, for our people, for the country. Is a good thing. I think it should be continued. Because it is not only in the country, they are working throughout the world. So we should take this opportunity for our people, for our health system also, probably they can help also. And in research system also, probably they will help us. And they also, they can fund also, because we need many funding also in this sort of research work or other health system. Probably they will help us also.
So we found that this time, our national media as well as international media, they played a very positive role for the people. I should say that for the people, because whenever they find any mismanagement, they try to dig out that thing and bring it into the media to ensure the services, proper services for infected or affected people. Do you have any expectation from international donors or UN system as well as international media? If I ask you that, what is your expectation from them? Then what do you like to mention about that? What is your expectation from them?
The media, what you tell media, they are doing a great job or great role actually. This COVID, media, they are trying. They're actually their most important thing. What I feel, what they are doing, it is for the people, people's awareness about the health system and also the others. So that is the main thing they are doing. It's a great thing they are doing actually. Media and with the doctors, public health workers, physicians, in every day in television, other media, Facebook, newspapers. We're trying also, but they are doing their great job actually. Even with these, many journalists, they are going to the affected person. They are taking an interview. They are making their this video and they spread it to the whole country. Even in the Facebook, for the world, it is not only in our country, everywhere more or less. They are doing a great job. I should say I must congratulate them what they are doing. I must again, I request them to continue their job because people's awareness, media's role is extreme. Without the role of media, we could not aware the people also. Even now we are talking, even television, every day we are talking many things. It's a part of media actually. So they are the person, even they are also, I told that the frontline fighters also, like doctors, security workers, and media, they're the frontline fighters also. So I will request them to continue their work so that with their awareness working in different parts of media, people are getting benefited also. Not only in this country, throughout the world. Even you told the organization, donor, those who used to give donoring organization, WHO, UNDP, others, many organizations in the world, they are also actually getting the news from the media actually, and they are going to help us. So media's role is, I think, very, very satisfactory and it's quite good. And we are getting benefited. Everybody we are getting benefited from the role of media. So otherwise we would not know about this. And you can now in a minute, whatever is going to happen in the world, any part of the world, we are now looking at once, you can see, and we are getting awareness. People are getting aware. This role of this media, that is important. Should be continued.
So, one more issue, like, if we look at the situation of COVID-19 and investment, we found that Gates Foundation, Bill Gates, he declared and invested lots of money for COVID-related, research and intervention and vaccine development and other issues. And WHO Director General Tedros, he gave lots of statement and he's trying to do as much they can do by WHO. Do you have any message for them, like for Bill Gates and Tedros, Director General of WHO?
The message means they are actually, I welcome their mentality, that their effort also. It's a good thing. They're rich men, they want to have money. So their money, they're not using for themselves also. They have to give them to those who are need, poor people, for the human being, mankind. It's a good thing. I welcome them. And probably they will give many countries, especially the third world countries, developing countries, poor countries. It is a good thing they are giving. There probably some of them, they are investing quite good amount of money for the invention of vaccine also. That's a good thing. Probably Bill Gates or some other foundation, they have declared they will give the vaccine free of cost or without money to especially the third country or poor country or developing country. That is a good thing. So there are, what I feel, government also, they can try, contact with them, so that what they want to give us, we can take the benefit from our side as early as possible. That is good thing. It's not only the WHO also, even the vaccine, when the organization, those who are preparing the vaccine, they will probably donate some amount or some part of vaccine to the WHO. And WHO will give this vaccine free of cost to the developing countries also, poor people. So we can take the chance, we can start lobbying now with the WHO, so that once the vaccine, or any drug even, it will be available, or even test easier. We can get it. We are trying from our own. We'll try our government will try ourselves. That is also true. But if they give, why we should not take the chance? We can take the chance so that our people will be benefited. That is our target. People of this country, especially in health system, if we get some good thing, we can take the chance also. We can start lobbying now from the beginning. So that anything, whatever they want to give for drug, vaccine, research work, and also for people's health, for development of where they want to donate, you can take it, you can take the chance.
So do you have any message for our entrepreneurs? Like, we have a lot of rich people in Bangladesh. Those are doing business, lots of people are doing health sector. There are also big players. Do you have any message for them?
No. Message saying after I used to tell many times, especially in this situation, there are lots of disaster in this country. You have seen Ampan, you have seen the cyclone, and also the flood, and again, there are a lot of things. These people, enlightened by those who have money, there are many people in this country, big man, businessmen, enough money, they can help with the well, and they are helping also, not only the government. In many places in this country, even in village, in remote place, many of our richest people, they are helping also to our people in any whatever they need. That is a good thing. I welcome them. I think whatever they have their capacity, they used to continue their donation for the people, for the mankind, or for the health system, whatever capacity they have. They should continue this. Actually, they are continuing. They're giving their help to the people. They're donating and helping. Not only that, many you've seen for the doctors. I've seen they are giving mask, cap, shoe cover, PP, gown, other to the doctors, health workers. Many organizations they are giving free of cost. So that is also a good thing they are doing. Even in many places I've seen water. They are giving purified tablet, medicine. They are giving. They are supplying. Some companies too. Some we have seen the media. Some they are giving without informing the media, but they are giving. That is true. There are many good people in this country also. It is not only the foreigner here also. So I think they should continue. It is for us, for people of us, mankind, for the human being, mankind, because we are for others. We should live together peacefully. And that is the reason. It is quite a good thing. I welcome them. I again request them to continue their help for the sufferers, poor people in this country, those who is in need. They must continue this. They should continue this, not must.
So, final question. If I ask you that, if Prime Minister asks you that, dear Dr. Abdullah, would you like to have something from me for the people's health in Bangladesh? What you will ask from her?
No, personal. I have no personal interest. For myself, I don't want to take anything from her. What I think, actually, she is working day and night, almost 24 hours for the people, for the country. It's not only health. She has to think many things, many sector, many other. I did told natural calamity in this country. So he has to see many things, national and international issue also. But I should request to our people so that we must be sincere. Because there are a lot of complaints, corruption and other. We must not do this thing. Because she is trying, if we do not help her, how she will be alone, how much work she can, it's difficult. So because in Bengali or whatever it tells, she has the hand, we must ensure so that she or her hand become more and more strong. She is giving her food. So we'll cooperate with her. That is more important. We need not only she, because everywhere, every ministry, health worker people, other ministry people, they should cooperate with her. Other she cannot alone. It's difficult for her. One person, how far he can work, how far he can do for the country. He's trying his best. She's trying. There's no doubt. So we, the person everywhere, with the people, must be with her. And we must pray, I must pray, everybody should pray, so that he should live in a good health. He should meet his boy. He should be, I think, if she is fine in good health, Allah will let her survive for even more than 100 years. Then he can serve to the nation, serve to the people, serve to the country. That's the good thing I want. I'll tell her this thing. You should survive, you must be good enough, you should be fine enough, you should be free from a disease. And also one thing I tell, her brain is very fine, is the brain of her father, or father of the nation, Bangabandhu Sheikh Mujibur Rahman. She is like her father. She has the blood from her father. In her artery or vein, whatever you tell, there is the blood of our father of the nation. Probably she'll be able to continue her effort for the betterment of the country. That we want to do.
Sir, thank you so much. We hope that this time Bangladesh will overcome this problem, and your contribution and your love for the people will be, help people to have the confidence, live with this COVID-19, and we expect that all, as different UN agencies like UNICEF, WHO, UNFP, and others help Bangladesh this time, including ADB, World Bank, Canadian CIDA, Swedish CIDA, and others. They will continue to support us, and we will work together for the people of Bangladesh and to overcome this COVID-19, as well as maybe we need to live with COVID-19, and we hope that we'll cope up this disease and beat this disease by our technology, knowledge, and unity. Thank you, sir. Thank you so much for giving us time. Thank you so much, sir.
Thank you very much. Thank you, the audience also, and the organizer. We have arranged this beautiful and nice meeting also. We are waiting for the best things where it will be, this present situation will go over. We are waiting for the best thing in future. Thank you very much again.
Sir, we will work through that, sir. Thank you, sir.